Hello everyone, and welcome to Cleaning and Sanitation Concepts in the COVID Era and Beyond. This webinar is part of NEHA's COVID-19 Essential Functions of the Environmental Health Workforce live chat series, which highlights the role of environmental health workforce in recovery and resilience of the environmental health public health system during the COVID-19 pandemic. Please note, this session is being recorded. If you are not okay with this being recorded, you may disconnect at this time. Today's live chat is proudly co-hosted by NEHA's business and industry affiliate. A sincere thank you for the careful planning and coordination of this event. My name is Laura Wilde, and I am the Senior Program Analyst in Food Safety for the National Environmental Health Association. I'm joined by my colleague, Taryn Laird, Public Health Communications Specialist. It is our pleasure to facilitate today's live chat. The COVID-19 pandemic has had a tremendous impact on the environmental health profession, and we thank you for your hard work and response efforts during these unprecedented times. NEHA is dedicated to supporting the environmental health workforce, and we've provided several resources for our partners, including information on the pandemic and resources for our members and real-time information for those seeking more resources and tools. There are countless benefits to becoming a NEHA member. Connect with your peers, network, and get access to valuable resources and educational materials. We stand by our environmental health professionals who work so diligently towards a healthy environment for all. If you are not already a member of NEHA, check out our website at neha.org to learn more. A bit of housekeeping before we hear from our panelists. All attendees are in listen-only mode. As a reminder, this webinar is being recorded. Throughout the discussion, you may submit any questions you have in the Q&A box, and we will do our best to answer as many questions as time permits. I'm pleased to introduce the current Business and Industry Affiliate President, Alicia Collins. Alicia is a Food Safety Program Manager with Stereotech, a registered environmental health specialist, and a past president of NEHA. She will introduce today's presenters. Alicia, I'll turn it over to you.
Thank you, Laura. On behalf of the BIA and NEHA, we appreciate you joining us. It is my honor to introduce our panel of experts this afternoon. Anna Starobin is a corporate scientist and a leader of microbiology, food safety, and public health for Ecolab's global QSR and FRS divisions. Her responsibilities cover food safety, environmental testing, equipment evaluation, outbreak prevention and recovery, regulatory product development, and research for Ecolab customers around the world. Dr. Starobin is actively involved in industry food safety projects. She's an author of several publications, patents, and multiple white papers. She gives food safety talks covering topics such as cleaning and sanitation, equipment design, hand care, produce washing, environmental testing, and outbreak prevention and recovery in the USA and internationally. Dr. Emily Crispell is a food safety microbiologist with Chick-fil-A Inc. In her current role, she identifies food safety risks and develops solutions to support a strong food safety culture within restaurants. She serves as a microbiology subject matter expert for challenges related to bacterial and viral pathogen survival and transmission. Dr. Crispell's professional journey began with supporting foodborne illness outbreak investigations for Georgia Department of Public Health. She holds a Bachelor of Science in Chemistry from the Georgia Institute of Technology and a doctorate in microbiology and molecular genetics from Emory University. Her numerous peer-reviewed publications focus on mechanisms by which pathogens cause disease and resistance to antimicrobials. Her work has been recognized at the local and national level through multiple awards and invited talks by the Georgia Environmental Health Association, the American Society of Microbiology, and other professional groups. Welcome, Dr. Starobin and Dr. Crispell. We are privileged to have you join us to discuss this important topic today. I will now turn it over to our first presenter, Dr. Anna.
Thank you very much. I will share my screen, hopefully. Okay. Good afternoon, and thank you very much for inviting me for this talk. During this talk, we're going to cover a couple of topics, which include challenges associated with COVID-era sanitation. We will talk about wash, rinse, sanitize as we know it. We will talk about the news in our cleaning and sanitation areas, and we will talk a little bit about new normal. So let's start with the challenges. The main challenge today is that we are trying to optimize our managing of the processes based on the knowledge which changes daily. And therefore, we have to adjust our practices and our understanding on a regular basis. And it's new normal for us. The big learning lesson and the big advice which we all need to follow is that we have to rely on evidence-based classic risk assessment principles and think about the practices which we're going to be implying and following and addressing through our risk management as a virus would think. Follow the steps which virus would be following if it wanted to do you harm. So let's start with understanding the risk factors. First of all, the coronavirus could be transmitted through your employees. It could be transmitted through your guests, your customers. We need to think about how the virus is being spread. We know that the main route of transmission is airborne, it's airborne infection. Therefore, we need to think about practices and mitigations, which are important for airborne infection. And it is new infection, but the good news that we have dealt with other airborne infections. There are a lot of similarities, and therefore we can use the practices we learned from the past life. We need to think about surfaces which we touch, even though the surfaces are not known to be the main route of transmission, therefore they're important, and we need to think about that. Now, let's think about what we have done in the past. And we will move on from what was done in the past with what we are planning to do in the future and what is different. So what we knew and what we did and what we will continue doing is washing, rinsing, and sanitizing. This is nothing unusual, nothing new, but just a refreshment. The washing step, as we know, removes soils and organic matters. And we know that sanitizers are designed to be placed on the pre-cleaned surfaces. So it is very important to have surfaces cleaned before we sanitize them. The next step is rinsing. The rinsing is a very important step as washing because we need to remove the debris which we loosened up during the washing step. And we need to remove the residual detergent because some of the detergents are charged differently from the sanitizers, and therefore they could neutralize them if we don't wash them off. And the last step is a sanitizing step, which is designed to reduce 99.999%, other way we call it 5-log reductions, of microorganisms of public health importance. And you see I bolded the public health importance because a lot of people are doing total counts and measuring the residual total counts, and it's not exactly representing the testing which is done for registration of this product. We are looking for 5-log reductions of pathogens. Now, what is new? The new word is disinfectant. It's not entirely new. We've used disinfectants for cleaning in cleaning situations like norovirus and many other procedures when disinfectants were needed, but they were somewhat in a shade. We didn't know much about them. Some people were trying to use sanitizers to clean norovirus. So the main differences are in this slide. Again, sanitizers will provide you 5 log reductions, 99.99%, while disinfectants will kill it all. Will kill fungi and viruses and bacteria, but not necessarily spores. Sanitizers, mainly, most of the sanitizers are designed to kill bacteria, not viruses. There are new sanitizers on the market which have virucidal claim, but it's recent and it's not common. Sanitizers do not require portable water rinse when they're applied on food contact surfaces, while disinfectants do. I'll talk about this more. And sanitizers are mentioned and specified and talked about in the food code, while disinfectants are not. Now, when we look at the sanitizers versus disinfectants, there's this little diagram here. Again, as I said, sanitizers are designed to kill bacteria, and very rare, but there are new sanitizers with virucidal claims. So these are new. Most of the people do not have them. And disinfectants are designed to kill bacteria, fungi, and viruses. So if you have a disinfectant, you would see multiple other microorganisms besides bacteria. Now, as we look at the bacterial resistance, there are bacteria and viruses which are more difficult to kill, and there are those which are less difficult to kill. The least difficult to kill are enveloped viruses. This is a good news for us because COVID, SARS-2, H1N1 are enveloped viruses. Therefore, they are not difficult to kill. The next in line is vegetative bacteria such as Salmonella E. coli. Fungi will go next. And if you look at the next one is non-enveloped viruses, which include norovirus and Hep A. So these are more difficult to kill viruses. So usually when you can kill norovirus, most likely you would be able to kill your COVID SARS-2. And the next two mycobacteria and spores are the most difficult to kill. Now, when people are asking us how many log reductions your disinfectant has, we usually try to educate them and show them the differences in the test methods which are used for registration of sanitizer as a disinfectant. You can see I'm a microbiologist, so I'm showing you the diagrams of the microbiology testing. Not exactly expecting you to run this test, but you will get an idea how we run those tests. So we have our bacteria on the left hand, green, and we add it to our used solution of the product, keep it there for 30 and 60 seconds, and then we'll look at the residual, what's left. We compare it with a buffer, which is not antimicrobial, and this way we calculate our log reduction. When we test disinfectants, it's an entirely different procedure. We have these metal cylinders, which we base in a bacterial broth. Then we dry them, and then we put them into the used solution. And we repeat this, we put each cylinder in one tube, and in total 60 tubes. In order to register a disinfectant, we need to show that 57 out of 60 carriers are technically sterile, because in the tube on the right, you can see if you have one microorganism left, the tube would be cloudy. Tube should be clear in order to be considered clean carrier. You can see the difference. For sanitizers, we test in a solution. For disinfectants, we test on the surface. It's usually much more difficult to kill bacteria on the surface than in a solution. Therefore, there is no 5, 6, or 10 log reductions for disinfectants. It's number of carriers, and they can vary, but we would not be able to give you log reduction if you are asking us about that for disinfectants. Now, another important part of understanding your products is to be able to read your label. Many people are going to EPA website and trying to find information about efficacy of the products using the product name. In many cases, it's not very useful. You need to use product number. So in this picture, you can see EPA registration number. Usually it's either 3 or 2 different numbers separated by little dashes. And 3 or 2 depends on is it a registered product or is it sub-registered product. You usually need to look up your information on EPA website using these numbers. And again, base registrant company number is the first number, second number is product name, and the last number is a sub-registrant company number. So you have to follow this number in order to find this information. Now, let's talk a little bit about differences in cleaning, sanitizing, and disinfecting. These products have different functions. Cleaning removes the soil and could remove microorganisms which are built in this soil. Sanitizing, as I said, will reduce the level of bacteria to a safe level, and sanitizers will destroy the bacteria and viruses entirely. Now, let's talk a little bit about new normal. As we determine the frequency of cleaning and disinfecting, we need to evaluate the risk. And based on the risk, we would be able to set up the frequency of your cleaning and disinfecting. You need to look at infection risk in your area. You need to look at the foot traffic. You need to understand the soil load, what type of soil it is, what type of surface. So there are a lot of different things you need to look into in order to understand and evaluate your frequency of cleaning. It's a good idea to revisit these processes because, as we know, situations change, the number of cases change, and therefore we would reduce the frequency or increase it based on the current epidemiological situation. We want to implement your enhanced hygiene, apparently hand washing, wearing personal protection equipment, using your cleaning and disinfecting processes. Let's talk about differences of cleaning and disinfecting. Again, when we apply disinfectant, it's different from your sanitizer. We start with a pre-clean surface, then we disinfect, then we wait the amount of time specified on the label, and then we dry. This is what is being done for non-food contact surfaces. There are some products which can allow you to combine step 1 and 2, but again, surface needs to be clean. Now, the disinfection has another step. In addition to what I just described, you have to sanitize, and then you will need to rinse before you start your operation again, because the disinfectant is designed so it is not at the concentration sanitizers are, and therefore you have to remove it before you're applying food, can place food on the surfaces. So rinsing step is an additional step which we usually use and recommend for disinfectants on the food contact surfaces. Again, the surface needs to be pre-cleaned. Some products are registered as a cleaner disinfectant, so you can use the same product for cleaning and disinfecting. So there are a variety of tools which are available. You just need to read the label. And the last, I wanted to kind of summarize this talk with some assurance tactics and best practices. You want to increase frequency of cleaning and disinfection in public space during high traffic periods. You want to script a message for your staff to share with visitors. You want your visitors to be comfortable coming to your restaurants and your grocery stores and your other facilities. So you need to show them that you are not only aware of the situation, but you are taking care of your customers, and you might want to educate them as you are advertising your practices. You need to communicate your new cleaning standards through your website and emails and newsletters. Many of you already do that, but it is, we learned that it's a very good steps to follow. We also recommend you to be clear about expectations for behavior of your guests. Again, put a signature so they can understand that their fears are not exactly supported, and therefore they can visit your facility safe and not worry about the disease. Where it's available, provide hand sanitizer, especially at high traffic areas, especially when you do not have access to soap and water. As we all know, hand sanitizers are not a replacement for hand washing. So it is only in places where the water and soap is not available, and in places where customers are expecting to see them. This is the new norm. Probably we'll have them from now on always. Provide disinfectant and cloth or disinfecting wipes in public areas for use by employees, and encourage them to improve their sanitation practices. Educate them. Why do they do sanitizing? Why do they do disinfecting? What is the difference? That's very important. Again, as I said, not everybody understands the difference. Consider providing an opportunity for visitors and employees to provide a feedback on the cleanliness of your operation to enforce your commitment to their well-being. It is very important only from customer relations perspective, but also would allow you to give a feedback and improve your operations on a regular basis. At that, I wanted to thank you for the time you allowed me to present this presentation. And Emily, it's all yours. Thank you.
Thank you, Anna. Hopefully I can adequately follow up your talk here. And I'm getting some feedback. Are y'all hearing feedback? Okay,
yes, we
I'm sorry.
Okay,
let's see if this works better. Let me share my screen and we can get started. Okay. All right, thank you, everyone. Thank you, NEHA and BIA, for just the invitation for me to speak today. I thought it might be helpful for me to share some practical information on really the why behind different sanitation concepts. This is really to help facilitate the understanding of these concepts, particularly for people with non-technical backgrounds. Okay. And so to do this, I was thinking this would really help enable smart, informed decision-making for whenever someone is faced with a contaminated surface and needs to decide what to do at the moment. And so to help facilitate this, the things we're going to cover today are really just the basics, just to reiterate some of the things that Dr. Starobin shared with you earlier. Also talk a little bit about why the organism matters, so important factors to understand about viruses and bacteria. some things to know about the chemicals you're using, and then also how do you put all this together to make decisions every day. Okay, so back to the basics. So to reiterate what Dr. Strobin shared in her talk, it's really important to understand how the cleaning, sanitizing, and disinfecting steps all combine to form a process. And so this really breaks down into two key themes. One theme is to remove, and then another theme is to kill microorganisms. So to do that, for the removal step, this is cleaning, so washing and rinsing. And here you're performing this to remove soils and chemical contaminants so that the kill step can be directed actually towards the microorganisms of interest. Next, you follow up with your kill step, either with a sanitizer or disinfectant, and you can perform this step effectively once you've removed the interfering substances from your cleaning step. And so to really help, I guess, illustrate why cleaning is so important, I thought I would share a lab study we conducted that really simply illustrates this. Hopefully it comes across as simply to everyone here. And so what we did is we actually inoculated salmonella, so a bacteria of a public health concern, onto a surface containing organic soils. And then we performed different steps of the sanitation process just to see how much salmonella was killed. And so you can see on the green bar here, the surface initially held around 10 to the 7 or 10 million bacterial cells on that surface. If you look at the blue bar here, we skipped the cleaning step and we just jumped straight to sanitizing. And what you can see is that we only saw a 99% or around 100 times killing of salmonella on that surface. And so that's much less than the 5 logs of killing that are required for sanitizing on food contact surfaces. In contrast, we actually performed the full process as you're supposed to. So in red here, we pre-cleaned and then followed up with sanitizing. And what you can see is you now exhibit that full 5 log reduction or 100,000 times reduction of bacteria on that surface. And so what this does is really highlights just how soils can dilute the killing power of a sanitizer away from the microorganisms you're trying to get rid of. And so it's really important, pre-clean your surfaces. And so a good visual of this is really with an everyday example. And that's with the towel and the red bucket system that I think a lot of us are familiar with. So when you're using an open sanitizer bucket and a reusable towel to clean and sanitize, soils from that dirty surface are transferred onto the towel and then into your sanitizer bucket. And this depletes the sanitizer concentration. So the soil transfer increases each and every time you repeat this process. And so with each subsequent use, and you're ultimately left with little concentration remaining to actually kill the bacteria you're trying to eradicate. And that's really, this highlights kind of why this, maintaining the system is so challenging, because what you're doing is you're actually mixing functions. You're performing cleaning with a sanitizer system. And so we try to coach operators and our team members on different techniques that they can utilize to better manage this system. And so some of the practices we coach to are here listed on this slide. And so an important one is you could consider switching over to a single-use wipe system. And so choosing single-use wipes actually prevents the introduction of competing soils into your sanitizer and prevents or reduces the amount of depletion that you may experience. We also coach to test your concentration frequently. So, decide on a routine cadence at a minimum to test your sanitizer concentrations. And then if you have a high use bucket, test it more frequently, because it's more likely your sanitizer is going to deplete more quickly. And then finally, particularly here for quat sanitizers, we advise not to use a cotton towel. Instead, choose something that's quat safe and doesn't interfere with quats or, bind it up and prevent them from acting on your microorganisms. Okay, so next here, discuss some biology basics to highlight the fundamental differences between bacteria and viruses. I think a lot of us are familiar with thinking about viruses and maybe familiar with thinking about bacteria and maybe thought less of viruses until, the COVID pandemic really became a serious issue for all of us. And so understanding the fundamental differences between bacteria and viruses can really help with making the right decisions to address each of these risks. And so, as I hinted, the biology of each influences the mode of killing. And first, to orient everyone, I thought it'd be helpful to go over some examples of each. So some bacterial pathogens of public health concern would be Salmonella, E. coli, Shigella, Staph, whereas some viruses of concern could be norovirus, hepatitis A, or SARS-CoV-2 now. And so what's key is how they multiply and grow. So bacteria digest nutrients from surrounding environments to grow and divide and reproduce, whereas viruses cannot reproduce outside of a host. So they actually program infected cells to produce more virus. So what does this mean? So what this means is that surface properties for bacteria are different from our cells, meaning that chemicals that are food contact surface safe may be used to kill them. And so these are, frequently sanitizers, or they are sanitizers. In contrast, viruses actually may contain surface properties that could have similarities to our cells, such as an outer layer that's actually derived from our own cell membrane. And as a result, you typically need more powerful chemicals to kill or to inactivate the viruses, such as disinfectants, and these must be removed prior to food contact to minimize exposure. Okay, so you also need to understand the key pathways for contamination increase by bacteria or viruses, so that you can know really when to decontaminate your surface. And so for bacteria, these pathways are time and temperature driven or cross-contamination, meaning that bacteria can reproduce over time given the correct nutrients and temperature. And they can also be transferred from raw ingredients or from someone who's sick. Whereas viruses, the primary mode of contamination increase is cross-contamination. So transfer from a sick person, either coughing, sneezing, vomiting, or cross-contact touching a surface. And so with that in mind, when do you apply a kill step? So bacteria, it's every 4 hours at room temperatures or temperatures that support bacterial growth. This really cuts into the bacterial growth cycle, and also after cross-contamination occurs. And for viruses, it's important to disinfect after cross-contamination. And so because it may be difficult to know when viral contamination occurs, it's not something that we traditionally think about all the time. I wanted to highlight here a two-pronged approach to help mitigate contamination, and this is through prevention and disinfection. So prevention is really key to blocking contamination from happening in the first place, and components of this process could include exclusion. So exclusion of sick employees just prevent any introduction of the virus into the environment. Also key is establishing good hand washing practices. And this could be, establishing a routine cadence for hand washing. It could be making it easier for, your employees to perform. I know we have some operators who've chosen to install actually outdoor hand sinks to help make hand washing more accessible for our team members who are working outside. Another important factor to consider are physical barriers. And so for norovirus, these physical barriers could be the use of gloves on hands. And for COVID, it could be the use of face coverings. And so the other prong of the two-pronged approach is disinfection. And so with disinfection, it's important to establish a cadence to disinfect on a routine cadence that you establish, and then also consider the risk. So high-touch surfaces are more likely to be contaminated just because they're touched more frequently. And so you should disinfect these surfaces more frequently. Also, if it's a bodily fluid spill, then there's a high risk of viral contamination. And so for this type of event, you should disinfect every time. Okay. So next, we'll talk a little bit about chemicals and the chemistry, dig a little bit back into my background. There's things I don't get to think about very often these days. So we'll talk about chemistry for a bit. So understand your chemicals. So the first factor to really know and understand about the chemicals you're working with is the contact time. And so the contact time depends on both the task and the actual chemistry. And kind of a way to break this down and to make it a little easier to understand and remember is that if you are trying to sanitize a food contact surface and using a chemical that's approved as a food contact surface sanitizer, you can be confident that killing of your microorganisms of concern will occur within 1 minute. That's the regulation. It has to happen within 1 minute. In contrast, the contact time varies for non-food contact surface sanitizers and also for disinfectants that can be used on a variety of surfaces. And so the contact time for these is variable and depends on the surface type. It can depend on the chemical, and then it can actually depend on the organism that you're trying to kill. And so some common contact times you may encounter in this bucket over here on the right are, possibly 5 to 10 minutes. And so as a result, it's critical that you know and always follow the full contact time. And I thought to help illustrate this, we could actually take a look at some bacteria that are being disinfected on a surface. It just really illustrates why it's important to use the full dwell time or the full contact time for your kill step. So what we're going to look at here is an example of using microscopy to track disinfection of staph on a surface. And so to orient you over here at time 0, all the bacteria you see here on the screen are green, meaning that they're alive. And as they die or as they're disinfected, they will turn red. And so at time 0, as you can see, they're all alive. The screen's completely green. All the little dots on there are green. And what you'll notice is that complete killing does not occur immediately. So after 3 minutes here, it looks like only maybe a quarter of the bacteria in this view are red, indicating that only a quarter or so of them have died. At 6 minutes, you approach closer to 75% killing, and then it's really not after till the full 9 minute, this extended exposure contact time that disinfection is really achieved. So at 9 minutes here, you can see that the entire field of view is red, meaning that all of the cells have been killed by the disinfectant. Okay. So next, since contact times vary, this means that you must check the label of the chemical you're using to see which organisms that chemical works on and for how long you should let the chemical dwell on a surface. And so there's also a relatively simple breakdown that you can think of whenever you're checking the label for organism efficacy. And in general, it's good to know that food contact surface sanitizers are typically only rated for certain types of bacteria. And so I would say they're more, they're more focused for bacteria. Whereas non-food contact surface sanitizers and disinfectants are typically rated to kill more organisms. And so this could include bacteria, could include viruses, and it can also include mold. So big contrast between the two, so definitely check the label. And that should help you figure out what you're killing. Okay, so how do we put it all together? I just shared a lot of information. It's a lot to absorb and take in and try to figure out how it all relates to each other. So how do you actually organize all of this info into some actionable steps and actionable tasks? And when you think about it, it really distills down into kind of 4 key pathways to consider. It's important that you first consider the surface you're trying to treat, and then second, also consider the organisms that you're trying to inactivate. And so if you're trying to treat a food contact surface for the traditional bacterial pathogens of concern that may arrive on contaminated ingredients, such as uncooked chicken, you would clean the surface first and then sanitize, so wash, rinse, sanitize. Whereas for non-food contact surfaces, if you're also concerned about bacteria on that surface, a similar process may get the job done for you. And so you could clean and then follow up with a sanitizer again. Now, for non-food contact surfaces that may have been contaminated with bodily fluids or viruses, the bodily fluids, we don't know what's in the bodily fluids, so it's best to assume that you're going to need to kill viruses. You would clean and then you would follow that up with a disinfection step. So that should cover most of your organisms. And then finally, if it's a food contact surface and that surface has been contaminated with bodily fluids or with viruses, those are your organisms of concern, you would actually have to follow a more extensive process. And so to do this, you would first clean your surface, follow up with your disinfectant to kill all the organisms. And then because disinfectants traditionally aren't approved for food contact surfaces by food code, you then have to remove that disinfectant from the surface using a clean step, and then follow that up again with a sanitizer. And so this is how you would treat a food contact surface that's been contaminated by viruses. Okay, and with that, I would like to thank everyone here for your attention. I really appreciate your time, and I would be happy to answer any questions. And I just realized I must have raced through this talk. I'm a little ahead of schedule here, so we should have a little bit extra time for questions. So I will hand it back over to Laura and Alicia.
Great, thank you very much, Emily, and thank you, Dr. Anna, for providing us such wonderful information on the webinar. We are now at our time where we are accepting questions from the audience, so please put your questions into the Q&A box. And we'll try to get to as many of those as we can. So our first question comes up for Dr. Anna, if you would. Recently, the EPA approved a product as a food contact, no rinse disinfectant. Can this product be used in retail food establishments on a food contact surface and not require a potable water rinse?
Well, thank you, Laura. I would try to answer this question. As I mentioned during my presentation, that most of the disinfectants are designed to kill viruses while sanitizers are not. It has been a problem in the food industry because you have to use multiple products in order to achieve different goals. And therefore, some of the companies started to develop products which would be able to do both at sanitizing concentration. Sanitizing concentration does not require rinse. And if you can kill viruses at sanitizing concentration, EPA started to allow chemical manufacturers to make such claims. Therefore, there are several products on the market which are designed and registered to be a sanitizer with virucidal claims. If you have a product at sanitizing concentration which kills viruses, you do not need to rinse.
Great, thank you very much. Our next question is for Emily. How important is the type of fabric or applicator used when applying cleaners, sanitizers, and disinfectants? And could you maybe talk about some quat-safe towels? Because you did mention a very specific recommendation when you spoke about quaternary ammonium and using towels.
Yeah, absolutely. That's a great question, or both of those are great questions. So I'd say it's important, so both factors are important, the application and the chemical you're using. And so you should really choose both to complement each other. So for example, with the process of cleaning, what you're really trying to do is actually remove things from a surface. And so it's often a good idea to use an applicator type that actually provides some friction and can help lift and remove things from the surface. Whereas with the sanitizer, you're kind of performing the opposite task. We're trying to release a chemical onto a surface. And so to think about the applicator type for this, you would probably go with something that has more releasing properties than more binding properties. So that way you can ensure enough of your chemical is left on the surface to actually sanitize. And so for quat-safe options, there are a variety of quat-safe options out there. So we try to steer people away just from cotton-based towels because the organics of cotton readily bind to quats. And so what you can look for, you should check each specific towel, and the manufacturer should be able to tell you if it's quat-safe. The typical things to look for are applicators that are synthetic, and so they don't have those organics in them. And then some applicators may also be treated with something on the surface to prevent quats from binding to it.
Thank you.
If I could add to that, many operations, knowing the challenges with the towels, cotton towels, for towel buckets, use different chemistries such as chlorine. And that helps too, because sometimes having different type of towels besides cotton towels is challenging, because cotton towels are known to have a very good cleaning capabilities, and therefore they love to stay with cotton towels, and this is a way around it.
Thank you both. Dr. Anna, continuing with you, do you have any advice when selecting cleaning and sanitizing and disinfecting chemicals to ensure compatibility?
Sure, it's good question, because you don't want to apply a product and see your surface ruined after you did that. So what we usually recommend, to find some hiding area, so somewhere in the corner, somewhere under the furniture, somewhere where it could not be seen, and choose a little spot and try the product on this little spot in order to minimize the damage. In many cases, you can work with your chemical suppliers. We have a whole lab doing just that. Our customers bring us materials which they are worried about, and new products they are considering. And we're evaluating different type of surfaces and give our customers recommendation for using it or not using it. We had a situation when somebody had placed a lot of tiles in the store, and then realized that if you spill a Coke over it, the tiles are ruined. So you might want to do it ahead of time. That's about food and about chemicals, about anything which may end up on the surface.
Thank you. And we're getting a lot of live questions coming in about the temperature of water. And I'll go through several of these questions and I'll let each of you chime in. One of the questions is, when cleaning a surface, does it matter if the water is cold or hot, and what temperature should it be? Some additional questions came in about the importance of using hot water in the wash step during the wash, rinse, and sanitize process, and if hot water was effective for removing grease. So maybe if we could just have a discussion about that, that would be helpful.
Well, I can jump in and go first, and then Anna, you can follow up with probably the more technical correct answer. So from a practical standpoint, you know, warmer water makes it easier to break down chemical bonds and remove things. From a very chemical perspective, it helps kind of break things apart and pick it up. That's not to say that you can't clean effectively with colder water, but you may have to match a much more powerful cleaning chemical to help do the job that you're trying to achieve. And I just lost the second part of that question, Laura.
Really, just several questions have come in about the temperature of the water for the sanitizers, and if the hot water is a more effective means of cleaning when you're cleaning debris and possibly grease off of food contact surfaces.
Oh, that's right, grease. So grease and water inherently just don't mix with each other. They have very different chemical properties, and they actually kind of repel each other. And so you really need a surfactant, so like a soap, to help the grease bind to things that your water is carrying. So you really need that soap to pull the grease off. And that's all that I know.
In addition to that, as we know, food code specifies the temperature in the wash sink, 110 degrees Fahrenheit. So here we're very much not flexible. When we're choosing a cleaning temperature for surfaces, there are a couple of considerations. Everything is what Emily said is absolutely correct. The warmer water, probably the better it is for removing soil. But in many operations, as we know, people have limited amount of hot water, and therefore we have a lot of questions like, would you detergents be effective at cold temperatures. And in order to address that, we do a lot of testing when we develop our products at lower temperatures. So we are trying to accommodate those operations which do not have access to hot water. There are also exceptions to the rules of hot water. There are some products, mainly enzymatic products, which do not do very well in hot water. Matter of fact, they are designed to be used in the cold water. Therefore, you need to work with your manufacturer and better understand, is it hot water or cold water required to use particular products. You also need to think about the comfort of your employees. If you design something which needs to be washed in a steaming hot water, they probably will not use it. So the level of comfort is very, very important for compliance.
Great, thank you. The next question I'd like to pose to you, and maybe Dr. Anna, you could answer this for us. What about UV light as a disinfectant?
Well, thank you for asking this question. As you can imagine, in the COVID period, we are answering this question on a regular basis, do a lot of some studies, some literature search, and trying to figure out it for ourselves. There are a couple of thoughts. UV light is very effective antimicrobial. You have to think about distance of UV light from the object. You need to think about interfering objects when UV light is used. You need to think about the surfaces. Are they clean? Are they dirty? If the surfaces are dirty, UV light would not be able to penetrate through those surfaces. The other important thing is to understand that UV light is a complementary treatment. It's not a replacement for wash, rinse, and sanitize. So unfortunately, many people who are considering the technology skip this thought. And if it is a way to reduce your labor and time needed for cleaning and sanitation, it is not. But there are a lot of studies showing that UV light is effective against multiple viruses. COVID probably would be affected, but all of the above and many, many more, safety, there are different lengths of UV light. There's a whole science around it. You need to evaluate when you are implementing this technology or considering it. Hopefully, I answered it in a short way, but it's a long conversation.
I want to follow up and just reiterate one point from that, and that's really a safety point. And so with UV, in general, if it's powerful enough and strong enough to kill viruses or inactivate viruses, it's probably not something that you want contacting your skin or your eyes. And so there also may be additional PPE requirements to keep in mind if you're considering UV. Those are really important.
Yeah, and to your point, you probably need to be out of the room when the UV light is being switched on.
Yes.
Great, all very good points. We certainly want to keep our employees safe when they're trying to keep others safe. So thank you both for your comments on that. A question came in directed towards Emily. Do you have testing parameters and procedures already set up for testing the effectiveness of disinfectants and cleaners? Anything that you can share on that?
Yeah, so what we do, we proactively understand our chemicals and our chemical limitations before we implement them into operations. And so I would say we do a very thorough validation of the disinfectants that we're using before we even consider entering them into operations. So we do that step ahead of time.
Thank you. And this question really kind of piggybacks on that. And it is on all surfaces in retail environments. How is cleaning compliance by restaurant staff being measured? And if new compliance methods are being used, are they considered reliable?
I think the best way to really dig into this and to get at that is to establish a system and then have that system be measurable somehow. And so that could be, you know, setting up a system, say, hey, I'm going to disinfect once an hour, and then, you know, provide or consider using some sort of visual cueing where somebody could sign off and say, hey, I've disinfected these surfaces. And so you could actually go down the list, you know, every hour and see that it's been performed. Another way you could do this is the use of timers. So if you had some sort of timer went off that, you know, cued to somebody that it's their time to go and disinfect or sanitize their surface, that could be another approach. And so I think it's really important that you establish a robust system, and that's the best way to maintain compliance.
Thank you. Do you recommend changing to a different kind of sanitizer? And how often would you recommend changing sanitizers, if so?
I guess I'll try to answer this question. So, you know, the rotation of sanitizers is a topic which is being discussed very common, and it spills over from our fear of microbial resistance related to antibiotics. As you all know, antibiotics are designed to kill the bacteria, but not to kill people. We are applying them on our body, we're ingesting them, therefore we need to make sure the concentration is enough, but not too much. And this difference is not very big. It's if you need X amount of antibiotic to kill something, you probably would use a little bit less than X to make sure that the body is safe. This is not the case with sanitizers and disinfectants. If we need X of something to kill the bacteria on the surface, we can use 1,000 times X to kill it and apply on the surface. And this is exactly the case with the sanitizer disinfectants. There is, if you are doing the processes right, there is nothing really left to become resistant. And therefore require rotation. The challenge is that we are confusing the definitions. The resistance could be in various forms. There is resistance which is genetic, and therefore there is nothing you can do if the antimicrobial genetically is not useful to kill microorganism. If antimicrobial is designed to kill and destroy an enzyme, and the cell doesn't have this enzyme, you're pretty much wasting your time using this antimicrobial. This is genetic resistance, and therefore you need to choose the right antimicrobial. If you are dealing with antimicrobials and resistance, which is not really resistance, it's tolerance. It's something which is could be reversed as soon as you start using the right processes. And this is mainly what we're dealing with in retail environments. We need to make sure that our processes do not allow for this tolerance to happen. We need to use sanitizers and disinfectants at a concentration which they are designed. There are numbers, so they are not taken out of nowhere. They are based on our efficacy data, which we generate in the labs. We also have to make sure that the contact time is right. We need to make sure that the surfaces are clean, because you cannot quite kill the bacteria unless you reach it. If we don't clean surfaces, we create biofilms. And then it is very difficult for antimicrobial to reach these bacteria which are built in the biofilms, and therefore we're using concentrations which are lesser than those we need to kill bacteria, and therefore we're encouraging this tolerance. So there are a lot of other things you need to think about. Towels we talked about. If you don't have a right concentration in your towel bucket, you're encouraging your bacteria to get adjusted, to learn how to survive this concentration. And therefore, rotation in retail, somewhat unnecessary and operationally challenging. We have a dispenser on the wall. Are we going to replace the dispenser every time we decide to replace the sanitizer? It is very common to rotate sanitizers in manufacturing because they're dealing with a variety of microorganisms. You might deal with yeast and molds one day, and you're talking with the spoilage organisms. So you need to think which facility you are working in and what bacteria or viruses you're worried about. But in retail is usually operationally very difficult and technically unnecessary.
Great, thank you very much. And we are at the end of our time today. And before we sign off, I know that we had several questions on the board that we did not have time for. So you can feel free to send those questions to me or to Alicia, and we'll be sure to get those responses for you. On behalf of NEHA, I would like to thank the presenters. I'd like to thank the Business and Industry Affiliate and all of the attendees for their time and participation today. And of course, your never-ending dedication to the environmental health profession. Thank you all so much for your participation. Be well, and we'll see you next time.
Thank you. Bye-bye.
Thank you.